Welcome to the LDN Radio Show, brought to you by the LDN Research Trust. I'm your host, Linda Elseygood. I have an exciting lineup of guest speakers who are LDN experts in their field. We will be discussing low dose naltrexone and its many uses in autoimmune diseases, cancers, etc. Thank you for joining us. This show was sponsored by Dr. Schwartzman, who is the founder and medical director of the Whole Family Wellness Center in Portland, Oregon. He studied at the National University of Natural Medicine in Portland and has over 20 years of experience in natural health, medicine and research. His work has been published in numerous scientific journals. Visit wfwcenter.com. Today my guest is Dr. Igor Schwartzman from Portland, who I had the pleasure of meeting at the LDN 2017 conference. Thank you for joining us today.
Thank you, Linda. Likewise. It's
been quite a while, I think, since I first interviewed you. It's been several years, hasn't it, in fact?
Yes, a little while, a couple of years.
But for those listeners who haven't heard about you, or listen to the interview, could you tell us, your background, please?
Sure. I'm a trained naturopathic doctor in Portland, Oregon. I went to the National University of Natural Medicine in Portland. Prior to that, I had spent some time at the Harvard School of Public Health and Boston University doing some research in respiratory physiology and cardiovascular health, and then eventually transitioned to clinical practice, and here we are today.
Mm-hmm. So how long ago was it when you first heard about LDN?
At this point, it's probably about 5+ years, so a relatively short amount of time.
Mm-hmm. So what has been your experience to date in this 5 years?
Well, I work with a lot of people who have autoimmune disease, particularly Hashimoto's thyroiditis, which is an inflammatory process of the thyroid gland. And so the vast majority of people who have inflammatory conditions, the use of LDN has been an indication. So I have a pretty substantial current group of people who use LDN. And it's made a pretty profound difference in their health. And I certainly have a lot of fascinating experiences that my patients have had.
Mm-hmm. And could you share those with us?
So generally, when I see people with Hashimoto's thyroiditis or Hashimoto's hypothyroidism, many people experience common symptoms of fatigue, generalized pain, joint aches and pains, weakness, mood issues, and so on. And so some of the most profound differences have certainly been a decrease in generalized aches and pains, decrease in those inflammatory type of symptoms, and it's been really wonderful to observe such a trajectory of a decrease in the symptomology of my patients. Certainly sleep. Some patients report a deeper sleep, improved moods, weight differences in terms of a decrease in weight. So quite a broad range of improvements. There are some patients who don't experience any changes, or at least nothing that's palpable for them. But as a vast majority, and I can't give the exact numbers, but I would say somewhere between 2 out of 3, maybe even 3 out of 4 patients certainly notice a change.
Mm-hmm. So if a patient comes to you with all those symptoms that you've just listed, how do you go about diagnosing them?
The general approach to diagnosing Hashimoto's thyroiditis is based on laboratory findings, particularly thyroid antibodies. So seeing an elevation in thyroid antibodies, which are our immune defenses, when we see a rise, we can suspect that there is some form of inflammatory process, particularly autoimmune thyroiditis. So it's largely based on lab markers. A large portion of my patients also come to see me already having been diagnosed. They actually seek me out after they have been diagnosed. So although I find a lot of new diagnoses and uncover them, the vast majority of patients are actually already diagnosed.
Mm-hmm. So once the patient has had the blood tests and you've seen that the markers are high, what regime do you get the patient on? I know it would vary from person to person, alongside of the LDN. Absolutely. The treatment regimen is very individualized, and a vast majority of patients, I generally like to take 3 to 6 months before I initiate LDN therapy as an adjunct treatment. The reason I do that is I have observed exacerbations in patients. So if someone is coming in and they're not feeling well, they're actually feeling quite unwell, and that's common, I have found that if we start LDN too early in the process, they feel worse. So to be able to have a shift in their symptoms, have some improvement in their energy, sleep, moods, and some of the basic symptoms, after that point, their ability to withstand the initial regimen of adding LDN appears to be improved. So in other words, making sure their thyroid hormone levels and function is appropriately managed, supporting their nutritional deficiencies if there are any, making sure that in women menstrual cycles are regular, and digestive health in people is supported. So obviously, being a naturopathic doctor, I incorporate a lot of nutritional therapy, clinical nutrition, and addressing nutritional deficiencies is vital. And making sure that any plant medicine that is incorporated in my treatment regimen is that every patient has to be consistent in order to feel the support that they need as far as their health care goes. And then after 3 to 6 months, after I find that they're doing better, but there are certain symptoms that still aren't improving or shifting. So that's when I often incorporate LDN. And I have found that prescribing LDN isn't protocol-based medicine, really. I have found that prescribing LDN, there's some art to it. As we both know, LDN is traditionally prescribed between 1.5 and 4.5 milligrams. Some go up, some go down, but the general dosing structure is such that we often see people at a target dose of 4.5. But it turns out that not everyone gets to 4.5. Not everyone can start with 1.5. So there's a little art to it. And I certainly have found that making sure that communication is open between myself and every single patient I start LDN with is vital. You were talking about gut health, diet and supplements, etc. What kind of a diet do you recommend your patients to go on initially?
In the simplest way I can describe it is an anti-inflammatory diet. So, for example, certain foods are triggers for certain people. Perhaps nightshades can be a common trigger, nightshades being tomatoes, peppers, potatoes, and eggplant. That family of foods can often be a trigger for people who have inflammatory conditions. In general, I don't like to be too extreme either. I often see someone who's coming to see me, and they are following a sort of a popularized autoimmune paleo diet. And the problem I sometimes encounter with folks who've followed that for a number of months is it becomes so extreme that there's often a loss of tolerance. In other words, when you avoid something for many months and then you reintroduce it, you may experience an intense reaction to the food that you once were able to eat. So when the dietary approach is particularly extreme, it often can lead to extreme reactions upon the introduction of the food. So again, I generally like to approach people with reducing the most common known inflammatory foods, like the nightshades, like gluten, like dairy, and then there are a number of others. And that's essentially where we start. But again, nothing extreme, because it's not always necessary and sometimes not helpful.
Mm-hmm. And as we said before, everybody's an individual, and you tailor your protocols to that patient. But supplements, if you had to pick the top 3 that you prescribe for patients, what would they be?
Mm-hmm. Well, number 1 is vitamin D. Vitamin D is a pro-hormone. It's key, right? It's essential. It's something that we all need. B vitamins are essential. They're so important in so many reactions in the body. Essential fatty acids are another one. They're anti-inflammatory, brain food. So those 3 are by far my key nutrients. So you asked for 3, those are them.
Okay. So have any of your patients experienced any negative side effects other than, vivid dreams, disturbed sleep, that kind of thing?
Yes, absolutely. And the most common side effect, as I had mentioned earlier, is if we start too early, they feel worse. Mm-hmm. Their aches and pains get worse. Their fatigue gets worse. They're just aggravated. But again, I have also found that some of that can be avoided by waiting 3 to 6 months while working with me, and then changing the dosing can be very helpful. So if someone's experiencing a bit of an aggravation, I go back. I reduce the dosage. And I have if you were to draw a bell-shaped curve, I would say I have a handful of people who are on a very low dose, 0.5 or so. I have the vast majority of people are between 3 and 4.5, and a handful of folks who are slightly above 4.5. So again, tailoring the dose or even the time of the day can generally either reduce the likelihood of aggravations or even avoid them in their entirety.
Okay. So for the patients who wait 3 to 6 months and start on an ultra-low dose, do you find they have any side effects? Anything bizarre?
Not usually. And again, I don't start every patient on an ultra-low dose, but it is an option if someone is being aggravated by 1.5. I generally start the vast majority of people at 1.5, unless there's a sense that I have based on my clinical observations of the patient that they could use a lower dose. No, the lucid dreams, some sleep disruption in the beginning is honestly the vast majority of aggravations, if you would, or some sort of an exacerbation. But for the most part, I don't really see a whole lot of negative side effects.
Mm-hmm. What about thyroid medications when they start taking LDN?
Great question. Thyroid medication can sometimes, the need for the thyroid medication can decrease. So because we know that LDN has the potential of being an immunomodulator, thyroid antibodies have the capacity to drop. And when they drop, thyroid function can improve. When thyroid function improves, there can be a time when we need to drop the thyroid medication. So it's important that when I initiate low dose naltrexone with patients, the need for the thyroid medication can drop, and we monitor that with lab values. And so, there's generally a 6 to 8 week follow-up of lab markers, and we watch. We also watch for the person's symptoms. Sometimes they know what it feels like to get too much thyroid, and their symptoms are, they have a sensation of being, as they describe, to be hyper-like. So we often can gauge their own symptoms and have a better understanding of what the thyroid adjustment may need to be.
Mm-hmm. What age range are these thyroid patients mainly?
I have a broad range of patients, but the vast majority of people I see are, probably the vast majority are 25 to 60. And of course, that's, again, I have fewer people who are much younger, 25 or so, and very few who are around 60 or older. So the vast majority are somewhere in the middle. Mm-hmm. Yeah.
And do you treat any children with LDN?
I do not. My practice is
adult medicine.
More adults.
Mm-hmm. Okay. So, other than thyroid conditions, what other conditions have you treated to date with LDN?
Gastrointestinal conditions like Crohn's disease and inflammatory bowel disease in general, so inflammatory conditions. RA, rheumatoid arthritis, psoriasis. So again, autoimmune in nature that are inflammatory, and it's a wonderful adjunct modality that I think is worth exploring for any practitioner.
Mm-hmm. And with the psoriasis, my findings have been that it usually takes longer for people to notice an improvement. What has your experience been?
When the patient is in a state of a flare-up, everything's aggravated, mm-hmm. the symptom reduction takes longer. However, once the symptoms have improved, it tends to prevent the flare-ups and prolongs the intervals between the flare-ups. And it appears to manage quite well, at least in my experience. And certainly I can't speak because on a greater scale because I have patients with psoriasis, but perhaps someone who focuses more in dermatological conditions would be able to comment more. But certainly in my experience, I think it keeps it at bay quite well.
Mm-hmm. I mean, I've seen pictures of befores and afters where people have had really angry looking skin and then it's been mm-hmm. clear, and it's taken a while for the scabby bits to come off to actually see the nice skin underneath. But I saw a young boy who'd obviously got really bad psoriasis, but he was like a teenager. And I was dying to say something about LDN, but I couldn't. Now, any other condition, I would be happy to talk to somebody, but I thought he would be horrified if some old woman was to dare to comment on it, because I think he was so self-conscious and absolutely awful. But I thought, it's something that would really be worth trying, even, if it didn't help, it was not going to do him any harm giving it a go. But psoriasis doesn't look awfully nice. And pain conditions as well with LDN. Have you found people have reduced pain?
Well, again, the nature of the type of pain that I see often is related to an inflammatory process, like autoimmune disease or some inflammatory condition. So the answer is yes, but if it's someone who's coming in with chronic pain, I generally don't see a lot of folks with chronic pain who don't have a concomitant inflammatory condition. So that's about the extent of what I can comment on as far as pain, and it's certainly a big piece of the puzzle for me having to use or wanting to use LDN in those people. Numbness and tingling is not uncommon in hands or feet, and again, in the joint aches, muscle soreness, those are really common with inflammatory conditions. So that's where I see the most impact, for sure.
It's amazing, isn't it, that when you are young and you haven't got an autoimmune condition and you feel good, you don't appreciate how good you feel until it's been taken away from you, isn't it? You just take good health for granted and think, I'm okay.
I get messages from patients who sometimes will start LDN, and it's not uncommon, those who have experienced that type of pain, who do benefit. And the message I'll get is, wow, amazing, ! I haven't felt this way in years. To your point, it can be transformational for those who benefit.
Exactly.
And from my perspective and in my view, because LDN has such a low side effect profile, it's a relatively cost-effective compound. It's irresponsible not to offer it as an opportune treatment modality for people who have health challenges.
So, anybody in the Portland area, and I don't know whether you do any web consultations, but how do people get hold of you?
I have founded a clinic called Whole Family Wellness Center in Portland. I also maintain an active license in Oregon and California, so I do have people working with me from both states and other states. Some people travel here, but Whole Family Wellness Center is where I spend the vast majority of my time working with people. And wfwcenter.com, or they can simply look up my name, Dr. Igor Schwartzman.
Wonderful. Well, we've learned so much from you today. Thank you very much. And if you had to give somebody, a message about LDN if they are contemplating trying it, but they are rather concerned, what would you say?
I would certainly encourage the person to first find a doc who has experience with it, because as I mentioned earlier, there's a little art to it, and there's no protocol. So someone who is able to manage it well with the person, because adjustments can and sometimes do need to take place, and also give it a chance. Trying it for one night is not a magic pill, but giving it perhaps several months, several weeks at least, is vital and it's important. And again, with such a low side effect profile and being cost effective, I think it's an opportune treatment for anyone who may actually benefit.
And the time frame, you're absolutely right. I've had several people over the years contact me and say, this LDN doesn't work. I've been taking it a week and I haven't noticed anything.
Yeah.
You have to be patient.
There are miracles where people experience a profound change in the first 2 weeks, and there are those who can experience the change that it seems to make in several months. So timing is certainly important.
Asking doctors how long, on average, do they think LDN takes to work for their patients? And the most common answer has been around the 4-month mark. Like you say, some people have a quicker response, some people have slower, but they normally would look at around the 4-month mark.
I would agree with that.
And I've also had some people who have told me after the very first night before going to bed that they've slept better than they have in years just by having the first dose. Personally, I had taken it for 3 weeks. I'd been told that I could have had worsening of pre-existing symptoms, headaches, stomach upset, vivid dreams, sleep disturbance. And I wanted side effects because I really wasn't very well. I wanted side effects to know it was doing something for me. And I had nothing. It could have been, aspirin. Did nothing until the 3-week mark. And it was like, whoa, yes, this is good. Yeah. It was quite amazing. But, 3 weeks is still very early for most people. But as I say, I was desperate for side effects. So all I can say is thank you so much for sharing your experience with us. And it was wonderful meeting you in Portland. And we'll be seeing you at the next conference in 2019.
That's wonderful. And thank you so much for inviting me. And likewise, I look forward to seeing you next time.
Thank you.
Thanks.
This show was sponsored by Dr. Schwartzman, who is the founder and medical director of the Whole Family Wellness Center in Portland, Oregon. He studied at the National University of Natural Medicine in Portland and has over 20 years of experience in natural health, medicine and research. His work has been published in numerous scientific journals. Visit wfwcenter.com. Any questions or comments you may have, please email me, Linda, Linda, at ldnrt.org. I look forward to hearing from you. Thank you for joining us today. We really appreciated your company. Until next time, stay safe and keep well.